Shoulder is an amazing joint which helps you throw, catch, hit, and defending themselves, and on occasions just getting into the top refrigerator shelf to get some food out. And what I end up seeing is a lot of pain in patients, which could be related to either the joint, the shoulder joint itself, or it could be the muscles around it. So the common conditions and causes of shoulder pain that I see in my clinical practice include inflammation of the tendons around the shoulder joint, which is called the rotator cuff muscles, and the inflammation is rotator cuff tendinitis. The other common condition that I routinely see is adhesive capsulitis, which in common terms is called the frozen shoulder. Next, I see wear and tear or arthritis of the shoulder joint, as well as the shoulder joint and the joint formed between the collarbone as well. So the acromioclavicular joint arthritis and the glenohumeral joint arthritis. Finally, the long head of bicep also travels through the muscle joint, and that's the bit that gets inflamed. So I see inflammation, wear and tear, and on occasions I see weakness or instability of the shoulder joint. And all of these in combination can give us pain in our shoulders. Pain is nature's way of telling you that there is something wrong inside any joint, but specifically the shoulder joint. And at that point, we do see people who would carry on with their activities, including sporting activities, and ignore the pain. To them, in my clinical practice, I ask them, do you feel that you're able to carry on with your activities of daily living? Do you feel that your shoulder stiffens up? Do you feel that your pain, that the shoulder is popping out of joint? If any of these questions have a yes to them as an answer, I would recommend for them to stop doing that activity, go and speak to their doctor, or locate an orthopedic specialist close by. Right, so shoulders are being used a lot more than other joints around the body. So there's always a chance that they might wear out a little bit more. So the signs where you start thinking about needing a specialist opinion is when the pain becomes constant, you have taken some simple pain medications and your pain carries on even with those, or when you stop taking a course of them. If it wakes you up at night, if it is routinely affecting your activities of daily living, qualities, and the pursuance of your hobbies, that is the time to seek medical attention. Other obvious times when you need a specialist to see is if there is repetition of injury to the shoulder, such as a certain contact sports, or that you've fallen and actually injured and hurt your shoulder joint. That's an excellent question. In my clinical practice, not all shoulder conditions and injuries require invasive treatment in the form of injections and surgery. Most of these can be managed at home with simple medications such as acetaminophen or ibuprofen regularly. Cold packs are very, very useful. Ranges of movement after you've had a discussion with your specialist orthopedic surgeon, which also includes home-based exercises, range of movement exercises. These become very, very useful. And on most occasions, in the coming few days, your pain is relieved with these simple measures. If the pain continues to happen in the shoulder joint beyond having used non-operative options, we do have other options which are invasive, which starts with injection therapy. And the injections could be used for various reasons. It could be used just to reduce the inflammation within the joint, but there are certain specific procedures we're able to relax the tightened up tissues inside the shoulder joint, which is called hydrodilatation. And if these options fail, then we move on to surgery. And in the recent advances in shoulder surgery, we end up starting with what we call keyhole surgery, where a small, tiny cut is made inside the shoulder. And with the help of a camera, we can confirm the diagnosis and treat it at the same time.